This is a government, or this is a society where we couldn't manage lockdown. We condemned thousands of elderly people to death. We forced everybody to have an experimental vaccine. There was huge social pressure put on people to take useless measures like wearing masks. I wasn't allowed to walk my dog. We were absolutely micromanaged within an inch of our lives and fed incorrect information. And yet we are going to trust this same society, this is not me saying I mistrust doctors, I don't, but we're going to give this same state the power to decide who lives or dies. I mean, what could possibly go wrong? And one of the things that really frightens me about this is that even if you put on your medical records that you do not want to discuss assisted suicide with your doctor, they are not bound to follow that. So at any point, a doctor will be able to raise assisted dying with you, assisted suicide, as many times as they want. It doesn't matter if you've got an eating disorder. It doesn't matter if you've got a mental health condition. Chillingly, if you've got Down syndrome, if you've got autism, if you've got learning disabilities, a doctor can raise the prospect of assisted suicide with you as many times as they want, completely unprompted, even if you've got on your record that you don't want them not to. And when we think of conditions like diabetes, that counts as a terminal condition. Same with an eating disorder. And we've seen in so many countries, in Australia, in Oregon, in the US, and in the Netherlands, and in Canada. Canada started out with the same legislation that's being proposed here. Canada said, okay, it's only for people with a 6-month diagnosis. Now we're hearing people are being told, no, we're really sorry, we can't afford to pay for your stair lift, but you can have medically assisted suicide. And this is what we're ushering in, and we're ushering it in on the NHS, which is what we all paid for. Frankly, if our taxes for the NHS are going to fund who lives, who dies, it's going to fund people being able to kill themselves, I think there's actually a case for us to defund the NHS, extreme as it sounds, because this is not what the NHS was all about. It's about saving lives.